Hi, everyone, and thank you for inviting me to the 2023 Global Gathering for Healthcare Climate Action. I'm here to present a case study of Newcastle upon Tyne NHS Foundation Trust in the UK, and I'll be talking about baselining our carbon emissions and measuring our reduction towards net zero. By way of an introduction, I do have multiple hats, as I'm sure a lot of people do. I work part-time as the Sustainability Manager at Newcastle Hospitals. I've been here for 3 years. I also run my own business, SmartCarbon Ltd, which is a small but fast growing carbon accountancy and consultancy firm. So, about Newcastle Hospitals, we are one of the largest NHS trusts in the UK with over 2 million patient contacts a year. But of relevance, we spend £780 million a year. That's after we deduct pay from that expenditure. And I see that as a potential lever for change and drive sustainability and net zero within the supply chain. We're also the first healthcare organisation in the world, we believe, to declare a climate and health emergency in 2019. This is our CEO, Dame Jackie Daniel. Always brave to be your first to put your head above the parapet, but Dame Jackie, certainly other organisations, local authorities and corporate organisations may have already declared a climate emergency, but we don't believe anybody had within our sector. So what was critical was that when she made that declaration, she stated that the climate emergency is in fact a health emergency and threatens our number one priority, which of course is patient health. She also committed us to fast tracking action and reducing our emissions in line with what science demands. So we've signed up to the UNFCCC Race to Zero, and we have ambitious net zero targets. We're also committed to collaborative action, whether that's across our city of Newcastle upon Tyne, but also within our supplier network too. We've published a climate emergency strategy that runs to 2025, covering areas of carbon, clean air, and zero waste. Today, I'm going to focus on the carbon targets. And as I mentioned, we have set more ambitious targets of reaching net zero for our footprint by 2030, which is actually 10 years sooner than the default NHS target, and 2040 for our footprint plus, which is 5 years sooner. One of the first tasks I did when I joined the organisation 3 years ago was to recalculate our carbon footprint. It had been published since 2009 and calculated on Excel spreadsheets, which was fit for purpose at a point in time, but we really wanted to take that up a level. So we brought in a master's student to help us. We obtained some funding from the North East Local Enterprise, meaning the project was at no cost to the hospital, and we used the best practice greenhouse gas protocol guidelines. We remeasured our 2019 footprint using the SmartCarbon platform, and by putting the data through that platform and improving our methodology, you'll see on the bottom right, we actually for the same year reported a 43% increase in emissions, which is purely a reflection of improved methodology and increased accuracy of reporting. That gave us a robust baseline that we could have confidence in to track our progress towards our net zero goals. So in our annual SHINE reports, you'll see this from last year's report, we've got the 2021 figures, the previous year and the base year. And in the right-hand side, we can track percentage change confidently across each emission source. And we're making good inroads in some of these, like trust fleet and water and business travel and so on. But our two most challenging areas remain our building energy, which is the green segment of our pie chart here, and procurement, which is the blue segment, which makes up over 70%. So we decided to improve our methodology for measuring procurement, and rather than sticking with the old method of spend-based analysis, which we found very problematic, useful for a one-off screening exercise, but it isn't actually measurement. And obviously the factors haven't been improved since 2007. And as our spend actually goes up, so do our emissions. It doesn't capture real life efforts of any individual suppliers, and it's impossible for us to reach net zero without spending £0 and pence. So we developed our own 5-step framework. We tried to keep this really simple. It's been running for 3 years. We have 760 suppliers working through these steps at the moment, which is 22% of our 3,000 strong supplier base, and we're really proud of the progress that we've made. 87% of suppliers on the programme tell us that they support our 2040 ambition, even though that is stretching. And we've providing these suppliers with support, webinars, case studies, etc., and asking them to measure and report their performance directly on the dashboard. So the next steps are that we have mandated these 5 steps, and it's a contractual requirement for all suppliers. We're focusing on the hotspots by spend, so which suppliers we're spending the most with. We are having phone calls and visits with them. We're working with multiple trusts and other organisations across the city to standardise this approach. So 2040 is not a long way away, 17 years and counting, but the opportunity is there to influence our supplier base and all work together towards that vision of a net zero future. Happy to share any of that information. My contact details are there. Thank you very much.